Today, we will talk about how to get health insurance without a job. Let's have a look at the details. You and your family need medical coverage regardless of your employment status, but maintaining insurance if you're laid off isn't easy to do. Thanks to Medicaid expansion and the healthcare exchanges provided by the Affordable Care Act, there are more ways to keep insured today than ever. Unfortunately, even the best options aren't great options, but with a bit of diligence, you can learn how to make the best of a bad situation. The first step is keeping your insurance through COBRA. See that you aren't getting cut off early. You are always entitled to employer-sponsored coverage for as long as you're paid up. A lot of employers will automatically cut off an employee's insurance whenever they're laid off or fired. Sometimes this is legitimate, but not always. Make sure you qualify. Coverage through the Consolidated Omnibus Budget Reconciliation Act, COBRA, allows you to pay for the entire cost of your health insurance at the employer's group rate if you lose your job. COBRA is available to the majority of employees who are laid off or fired, but not all of them. Talk to your plan administrator. If you get laid off, your health plan administrator is required to contact you within a few days to explain your options under COBRA. You yourself have 60 days from the date of notice to choose coverage under COBRA, and you are eligible for coverage for 18 months from the date of termination. The second step is getting insurance through a health exchange. Gather your tax information. The cost of insurance purchased through the federal or state exchanges created under the Affordable Care Act, ACA, is subsidized for many buyers. Unfortunately, the calculation of the subsidy for each individual is based on yearly and not monthly income, so even if you have no income as a result of your layoff, your subsidy will be based on the previous year's tax information. Estimate your medical costs for the year. Add up the costs of any ongoing care for the previous year. This should include the costs of prescription drugs and care for any chronic conditions, as well as any predictable ailments, such as the flu. This should at least give you a baseline dollar amount for the amount of coverage you'll need. Go to healthcare.gov or call the helpline. Once you've gathered your tax information, go to healthcare.gov and log on, or create a new account. You'll need to provide information about the size of your household, where you live, your identifying information, and your income. Be mindful of network size. Since all of the plans on the exchanges cover similar events, one of the primary ways they influence costs are by shrinking the size of your network. While that may not be important to you, it's something you should be aware of when choosing a plan. Consider the plans. Plans under the healthcare exchanges are graded on a scale ranging from platinum to bronze. Bronze plans have the highest deductibles, and platinum plans have the highest premiums and the lowest deductibles. The third step is qualifying for Medicaid. See if you qualify for Medicaid in your state. If you live in a state which has expanded coverage under the ACA, and you make less than 138% of the federal poverty level, you are eligible for Medicaid. If your state has not expanded coverage, it will be much more difficult to gain coverage under Medicaid. Check to see when you can enroll. You may qualify for a special enrollment period if you have experienced certain major life events such as losing employer health coverage, getting married, or having a baby. Otherwise, you must wait for the open enrollment period, which typically runs from November to December in the preceding year. Apply for Medicaid through the health insurance marketplace. If you qualify for Medicaid, you can apply directly through the health insurance marketplace. The marketplace will send your information to your state Medicaid agency, who will contact you about your enrollment. Apply through the marketplace online by creating a www.healthcare.gov account. Apply for Medicaid from your state agency. If you do not want to apply through the health insurance marketplace, you can also apply for Medicaid directly through your state's Medicaid agency. Depending upon your state, you may be able to do so online, over the phone, or in person. The fourth step is exploring other options. Look into getting added onto your spouse's plan. If your spouse has coverage, getting added onto their coverage might be a great option. As a matter of fact, if you or your spouse loses coverage, there is a mandatory enrollment period allowing one partner to be added onto the other's coverage. Find a private insurer. Although this is likely the most expensive option, it might be your only option if you don't qualify for a subsidy. The easiest option for going about this might be to contact a broker, as the price from a broker will be the same as the price directly from the insurer. Use walk-in clinics and urgent care clinics when you are uninsured. The process of getting health insurance after you have been laid off may result in some gaps in coverage while you enroll in your new plan. If you have any medical problems during that time, look into nearby walk-in clinics. These clinics are staffed by certified practitioners and are typically more affordable than paying cash for a doctor's visit. If you have a more severe problem that requires seeing a doctor, try an urgent care clinic. Thanks for watching our video. Please don't forget to subscribe to our channel.